and welcome to my channel. Today I'm going to be talking about the treatments that I had after I was diagnosed with cervical cancer. I ended up having the radiation, the chemotherapy. I did not have surgery, and I ended up having 25 sessions of external radiation with chemotherapy. Following all of that, I had 5 doses of high-dose internal radiation. For the external radiation, I went 5 days a week, so Monday through Friday. And on Wednesdays, I also had the chemotherapy. So I would have the chemotherapy, then drive to the location for the radiation, then have radiation. So Wednesdays felt like an all-day affair. So the week before I started radiation, I had an appointment with the radiation oncologist. And after my appointment, they took me back and had a CT scan done. And that picture from that scan was very important because they used that to base all of my other treatments for the external radiation on. So when I would go to get the radiation, I would sign in, wait, they would call me back, and then you would have to go take your shoes off and get up on a table, and you would have to pull your pants and your underwear down because it's cervical cancer is what I was being treated for. They always gave me a blanket to help warm me up. They would put a towel over my private area so that I was covered up. But right before they left the room, they had to remove the towel, and they would put a little tiny, basically like a face cloth, covering your private area. I used to laugh and joke because it really didn't cover up much, and I was like, I'm wearing a loincloth. So they would leave the room, and then the machine was behind where you were laying on the table, and these arm-like things came out, and they went around your body very slowly, and they took an image. Once the image was taken, they would be at their computer and they would look at that image and compare that image to your original image. What they want to do is make your body be situated in the same way as the original picture. So the table that you're laying on can move. So they can put it aside, they can put it aside, they can put it like this angle, they can make you go forward a little bit. So you can tell when you were really off because all of a sudden you'd be like doing this and stuff like that. But they want to get you in the same position as the original picture. Once they were happy with the position you were in, they would wait for the radiologist to give the okay, saying go ahead and give the radiation. And then this other board would come out, and it was sort of on top of you a little bit. And then that would move over, and they would go all around your body, and then go the other way. And then they would come in and cover you up and help you get changed, and then you can go. They say you have to be careful because sometimes the radiation could cause your skin to become dry, and it could cause hair loss in the area that's being radiated. The radiation can cause a burning sensation when you have to urinate. So some side effects that can cause nausea and vomiting in some people, and diarrhea and things like that. The chemotherapy agent that I had was called cisplatin, and when I went in for that, I had to go get up really early and drive to get there. We usually gave ourselves 2 hours to get there, and it usually took about an hour and a half, even though it's probably only about a 40-minute drive because of the traffic in the area that we live in, because we were dealing with rush hour traffic. So we had a little bit of time, usually, not always, before my treatment would start. They would call me back, and of course they'd check your weight and things like that. Before they start, they would give you a steroid and some anti-nausea medicines. You take that, you bring a snack, eat some food with it. They would clean off your port, and I'll show you my port scar. It's right here. And the port would be right underneath it. And the port has a soft spot that's sort of like a membrane. And when they take the needle for the IV for the chemotherapy, they would put it into that soft spot and put it into the port so that the medicine would go up the tube that goes up and into your vein. So they would clean that off and then put the needle in and then tape it up so it doesn't move around. And then they would get a big bag and they would put it IV fluid, and they would pump you with a whole bag of IV fluid. While you're getting the IV fluid down, the chemotherapy that they would be giving you was made in sight. And that took about an hour. So they would have a slow trickle on the IV bag. Once it was ready, they would have a double check and sometimes a triple check just to make sure that that bag was going to you, because you don't want to get somebody else's chemotherapy. So once they were double checked it, they would have you check it, make sure that was your name and your number and all that other stuff. And then once you were done with the IV fluid, they would change bags and then put that in. And that dripped for around an hour. And it's hard to explain. I could tell a difference when I was getting the chemotherapy. I just felt different and odd. It wasn't awful, but I can definitely feel like almost like a buzzing feeling in my body. Something was different. And then once that was done, they would come to get the bag off and then put another bag of IV fluids. Cisplatin is very well known for causing kidney damage, so they want to make sure you have lots and lots of fluids. After your treatments, they tell you to drink, I think it's like 20 cups at least of water a day, because they really want to protect your kidneys. Also, while you're there, every time you pee, they give you one, they call it the hat, a little thing that you'd put in the toilet so that when you peed, it has measurements, so you can measure your urine output. And at the end of the day, when you were getting ready to leave, they would add up all the output to make sure that you weren't having slow kidneys. Because you were getting all these fluids, you should be urinating as well. Are your kidneys acting like the way they should be? So they want to double check that. Once everything looks good, and you're not having any bad effects or anything like that, then you could go. So that was chemotherapy and the radiation. And like I mentioned earlier, I had 25 sessions of external radiation and then 5 sessions of the chemotherapy. I think it was a week or two stopped those treatments. I had a procedure done under general anesthesia to have a sleeve put in. And the sleeve was just a little tiny tube-like thing that they surgically stitched into my cervix. And that was going to be useful for the internal radiation. It was an outpatient thing, wasn't too traumatic or anything, so that was pretty quick. And then the next week I started internal radiation. Internal radiation is usually given every other day, and this is for high dose. There's a high dose and a low dose. I had the high dose, so I was in and out every other day. You can also get a low dose, and from what I understand, the low dose, you're in the hospital for a long period of time. So they put everything in, and you have a low dosage of radiation going into your body over like 19 hours or something like that. And nurses come in to check on you every once in a while, but they can't stay long because of the radiation. What I had was completely different. It was high dose. And with the high dose, you would go in, have to take everything from off your waist down. They'd give you the robes, and then they would take you back and they would make you lay down on this really high table. They actually had a step stool that I'd step on and then get on the table. And once you're on the table, they had these big stirrups, and they were way up in the air. So after you lay down, you're laying down, your legs are up in the air, almost making like a table. And they put your legs into stirrups, and they actually tie your legs down into the stirrups so you can't move. So once they're done with that, a nurse will wipe off the area, and then they'll ask if you took your medicine. An hour or so before you start internal radiation, you need to take pain medication, and they usually have people take something to help their nerves and calm them down. Unfortunately, I react badly to those things, so I didn't have that. I just had the pain medication. And they would ask me if I took my medication, and I would say I did, and they would ask you if you wanted some kind of numbing agent, and it was just a spray, and I always said yes. I don't know if it helped, but I said yes. Couldn't hurt. And it smelled like cherries. Then they wait for the doctor to come in. The doctor comes in, and they put a plug into the area that they're going to be, I don't know if I can say it, so you know where I'm talking about. And then after that, they would take these lines called tangents and put it threw the plug into your sleeve that they had surgically put in your body. That sleeve is allowing the tandem lines to go into your body and get the radiation where it needs to go. Once the doctor gets that in, they take gauze and they stick it inside so that the leads don't move. Once the doctor's done doing what he needs to, he leaves, and then the nurses take your legs off the things and you can't move. So the nurses slowly, one by one, bring your legs down onto the table. Then they try to make you as comfortable as possible because you're going to be there for a while. At that point, they move you over to the table to have a CT scan done. Then once the CT scan's done, you have to wait. And the reason you're waiting is because the doctors are looking at the CT scan they had just taken and looking to see where the cancer is in regards to where the tandem is. So they're looking, okay, the radiation needs to go this way and then this way and then this way. So they're creating a plan of how to emit the radiation where it needs to go. So it's about an hour. They say that as time goes by, it gets a little bit faster as they're used to seeing how things are going, and also when it gets smaller and things like that. So you wait. When they were ready, they brought me back to the radiation room, and the room was very small and I didn't see any machines or anything, and it was very interesting. And then they opened up the closet door and rolled out this machine. It was probably about this, it was about a rectangle. It was only like this big, and it was about 3 feet off the ground, and that was the radiation machine. And then what they do is they take the lines coming from the radiation machine and attach them to the lines that are now coming out of your body. And they have to attach it a certain way, so the person attaches it, they leave, and then somebody else comes in and then double checks that they attach them correctly. Then she took a meter and to see if I had any radiation already being emitted. I was clear. They left the room, and a big door, like a vault from a movie or something like that, closes slowly behind them. That was a little scary to see that door. But it closed, and then the radiation started to be emitted. It lasted about 5 to 10 minutes, and it wasn't that noisy. It was sort of like a humming, buzzing, clicking sound sometimes. And then it was over. The door opened. They took the lines, disconnected the lines, and then we have to wait for the doctor. The doctor would come in, take out the gauze, take out the lines, and then take the plug out. They usually would give me this really big sanitary napkin. I mean, the thing was really long and really thick. It had a cold pack in it. They'd break the cold pack because I had a lot of discharge, bleeding, and swelling after the internal radiation. The first time it wasn't as bad as I was expecting. I was like, that wasn't as bad. This should be fine. However, my second appointment, I was still swollen and my body was still not happy about what had happened the first time, so it hurt a little bit more. Then the third time hurt a little bit more, and then the fourth time hurt even more. And the fifth time, when they were putting the plug in, I did squirm a little bit because it just got to be so painful. The nurses were very encouraging. They were always telling me, "You're so good at this, you're so brave, you can do it, you're a rock star," and things like that, just trying to encourage me. And it felt good to hear, because you're trying your best. But I only had to go through 5 of those, so it went by decently, about a week and a half. And then, after my last dose, my treatment was over. I couldn't have any tests done for 3 months. The internal radiation continues to work after it stops. So just because it's over doesn't mean it's done working. So I had another PET scan 3 months after I finished treatment because they wanted to give my body enough time for the inflammation to go down and for things to continue working. So during that time, I was still having some of the grayish beige discharge, and it got better. And then at 3 months, I had my PET scan, and everything looked good. So that was the story of my treatments, and thank you for joining me. Subscribe if you haven't already, and if you're new, welcome. Thank you for joining us. And my next video will be the symptoms and everything that I suffered through during my treatment. So please join me then if you're curious to see everything that I went through. And I will see you next time. I hope you have a great week. Bye.